The world of HIV clinical research has been one of the great success stories, quite honestly, in the world of medicine. And it's thanks to people who participate in research that we have learned so much. And the reason we do research is because people come to us with questions that need to be answered.
When the ACTG was first established, AZT was the only drug that had come out, and it was only good for people who were literally dying of AIDS. And it was shown that it helped those people live longer, only 6 or 8 months longer, but longer. And so the next question was, is AZT good for everybody with HIV? And so that was the first study in the United States that tested thousands of people and gave them AZT and found that, in fact, yeah, it did help them. It slowed down the HIV.
I recall the work we did regarding the new drug in 1990, fluconazole. We used that little pink pill and studied thrush, where people got plaques on the inside of their mouth. We also used it to study candidal esophagitis, whereby people could not swallow, they could not eat, they could not drink. And the only alternative was a severe toxic drug called amphotericin B, and it was a lifesaver.
But we still had some other infections that were really big problems, and one of those was disseminated MAC infection. And we found over the years through clinical trials that just giving simply 2 pills of azithromycin once a week could prevent this complication. And again, even before we had effective HIV treatments, preventing infections like MAC would prolong people's lives.
For those of you who are old enough to remember, the early days were tough. There weren't any medicines, and the medicines that were initially developed were hard to take, had lots of side effects, and quite honestly didn't work that well. But then in the mid-90s, 1996 I believe, when the protease inhibitors came about and the idea of combination therapy came about, that was an altering moment in the event.
And we knew that already you had to use these drugs in combination. We had learned that. The ACTG had taught us that we had to use drugs in combination. So we added that rather than just gave it by itself. And once we added that, it was a triple drug combination, and really that was the first time we had ever seen the virus just completely be stopped.
And I think when you think about once-a-day regimens, it's been a huge impact on people's lives. They've been able to go back to work. They've been able to take their medicines regularly without having to deal with multiple pills. They've been able to actually function in a normal lifestyle. I think that's important for us because we were actually part of that. So I think the other important thing about Ohio State is that not only do we take care of patients and are involved in the research, but we also continue to educate ourselves as well as others. We go to national conferences and international conferences and present information to our colleagues, but we also listen and absorb and learn what's happening and what are the issues, not just here, but elsewhere, and how we can use all that information to make it better for us and the patients in our community.
Hepatitis C is now one of the major killers of our co-infected patients. If you need treatment for hepatitis C, come to our clinic. We have studies to treat hepatitis C, which will help you live longer.
I'm happy to be working in an environment where not only myself being encouraged to stay up to date on things, but also being around colleagues who I can turn to. And when I have patients who maybe challenge me with their problems, I have bright people all around me. And if it's not something that I'm involved with directly with research, my colleague down the hall is, and they can keep me informed about what other options my patients might have.
And that is really what we do. We educate each other, and we do this with students and residents and all sorts of trainees. When we don't know the answer, we ask one of our colleagues who might know the answer, and if they don't know the answer, we know where to go looking and who to call about problems.
One good thing about coming to OSU is that we have both a research staff and a separate clinic, but we're together in the same area, and so we work closely with each other. So we have the research nurses and the research pharmacists, and we work together with the clinic staff in coordinating care.
You know, being part of OSU is, to me, is wonderful because we offer them the OSU My Chart through our system. We work with our pharmacists to have a patient assistance program that we can help them get their medications, because that medication is extremely expensive and not every patient can afford it or has insurance.
When HIV first came out, I mean, there were no treatments. Everything was an experiment. Every drug was being tested on people. And so we are in that mindset of, and that's what the university does. It seeks new knowledge. It seeks better ways for doing things. And so we're not satisfied with what we have. We're always looking for better.
At the risk of sounding full of ourselves, HIV actually is our business. We do this every day. We keep up with things on a day-to-day basis, and we provide that expertise to our patients.